Hey, hello, everybody. Welcome. Thanks for taking your time to listen in. I'm going to pull up just a little presentation, so I'll share my screen. And let's put it on the slideshow. There we go. So I'm Dr. John Pitts at the Centeno Schultz Clinic. We're going to talk about non-surgical treatment for ACL tears. Just a little background who I am. Trained at Vanderbilt for medical school, then Emory for physical medicine and rehabilitation fellowship. So we focus with that training on treating musculoskeletal orthopedic problems without surgeries. And then did some additional training to focus on the regenerative medicine aspect of that and take it up to the next level. Originally from Chicago. I've been doing this for 8 years. I'm at the Centeno Schultz Clinic and treating ACL injuries for that period of time. Published a paper on the specific topic of ACL tears and was involved in our randomized controlled clinical trial where we were treating ACL tears as well. So that's just some other things I've been working on. And so, our clinic, we're kind of the first clinic to do this type of work as far as stem cells and via injections to try to help heal orthopedic problems. And so just in general, what we treat: headaches, neck pain, upper back pain, low back pain, spine pain, shoulders, wrists, hips, knees, and specifically ACL tears we'll talk about today. So our goals as a clinic, we not only treat these problems, we have to be good at diagnosing them. So we spend time diagnosing these problems with exam, history, ultrasound, reviewing MRIs and x-rays. We try to do the least invasive things possible. So everything we do is injections rather than surgeries. And we have many tools to try to get your body heal itself. So we want to try to avoid pain medicines that can have lots of side effects and avoid chronic narcotics. We avoid steroids that have a lot of negative effects, and we try to, when possible, which is most of the time, avoid surgeries, which sometimes are appropriate, sometimes not, but they have high risk and not all they typically cracked up to be. We also train others in this field. We study this type of work, so we've published 2 papers on ACL tears specifically. We track all our patients in the registry so we can stay up to date with data. And we basically created the procedure as well. So we create these procedures because there's no textbook or training as to how to do this type of work. So we had to create it on our own. I'm actually an author on a textbook for this type of work that hopefully by the end of the year will be out. So just to get an idea of what we're talking about here, when we're saying that we're going to treat an ACL tear, we're not talking about a simple injection that just might be in the joint or done in your primary care doctor's office or an orthopedic doctor where they just inject one spot with steroids. We're talking about complex procedures where we have to inject an area very precisely because most of the things that we treat usually don't get good blood supply or they've used up their local healing cells. So we have to redirect them precisely into the area. So that's something that has to be done with a lot of extra training, a lot of precision using X-ray or ultrasound. Specifically for ACLs, we have to use a very precise X-ray guided procedure where we target all parts of that ligament to have a chance of success. So what type of stuff do we inject? So we use the term orthobiologics. Which basically means any kind of product that stimulates your body to kind of repair. Most of the stuff we use is coming from your own body, going back into your own body. So that would be something like PRP or platelet-rich plasma. That has tons of evidence that can help with things like arthritis, mild to moderate tendon or ligament injuries or tears, such as some mild ACL injuries. And that can stimulate the healing response. We're talking about bone marrow concentrate that has stem cells, which is better for more severe arthritis, has evidence that, again, we published on ACL tears when they're larger tears. And then there are tons of other things that we can use, such as adipose tissue, different growth factors or cytokines, or things that come from cadavers or other people's cells that are allowed to be used. So let's specifically get into a knee ACL tear. So first, let's just talk about what the ACL is. So the ACL is an important ligament in the middle of the knee, a stabilizing ligament. It has 2 bundles, and these bundles act to prevent the lower leg bone or the tibia from going too far forward in relation to the femur or the upper leg bone. It also prevents excess rotation of the tibia on the femur as well. And so this ligament kind of protects the knee from getting injured when you're jumping and planting or cutting, going side to side. So sports like soccer, football, basketball, tennis, etc. And the ACL gets more stress when it's planted and maybe twisting or is hit, or if you landed from a jump and your biomechanics aren't good, so that knee twists when you land. So that's why you often see basketball players or football players or soccer players get these type of injuries. Women are more likely to get injured just because the angle of women's hips are usually wider, and so that puts an angle going inwards at the knee that puts a little bit more stress on the ACL as well. When your ACL is torn, it has some capacity to self-heal. So there is some evidence and reports that some injuries can heal on their own, but the vast majority typically don't heal up much on their own. And so if the knee is continuing to be unstable, the typical gold standard is doing ACL reconstruction, which we'll talk about. And about 200,000 of those are done per year. Now, but the reason why we talk about non-surgical treatment is the surgery can't be perfect. So is an ACL surgery a fix? If it were, then maybe, there's no need for us to treat it. So 3 questions we kind of commonly ask is, will doing that ACL reconstruction prevent arthritis? Because we know that when the ACL is injured, a patient is going to be more likely to develop early arthritis within a few years or more of the injury. So can repair that fix that or prevent that? With the surgery, help the patient get back to sports? Well, this is a big one for professional athletes. And I'm sure if any of you follow sports, your favorite athletes, some of them, maybe 7, 8 out of 10 get back to playing at a high level. And then, maybe a couple years later, you see those players fall off. So, that's the question we ask. And then, will the knee be the same? What's going to be different after the surgery? And so to understand this, when you have an ACL reconstruction, you're basically tearing out the original ACL. So what that does, you lose the natural nerve fibers that are important for proprioception, basically telling your brain where your knee is in space. Your ACL is at a certain angle to prevent those movement of the lower leg bone. For the reconstruction, you have to put it in at a steeper angle. So that does put more stress on the joint. That does not provide the same type of stability as a normal ACL. And that does still lead to increased arthritis and more stress on the joint. And so it doesn't prevent arthritis, and the evidence suggests this. So especially in young athletes, teenagers, early 20s, most of those patients are going to develop arthritis before age 30, which is far too young. And even in adults, a good number of patients would develop progressive arthritis, which is similar to if they didn't even opt to have the surgery. So the surgery does not prevent arthritis. Will it get athletes back to play? Not necessarily. So after 2 years, 30% of patients that maybe opted for surgery versus not, had lost strength in the leg. I reported they never were able to get back to the same level of sports or activities. And there was another study that showed there was no difference really in return to sports, having a reconstruction versus non-operatively. So obviously it will get some athletes back, but it's certainly not a guarantee. So it's no 100% fixed to get back to what you want to do. And then will the knee ever be the same? And so we know that those knees that have ACL reconstructions will not be the same. They're going to be less strong. They're going to have that problem with proprioception because the nerve has been removed. The angle is different, so it's going to increase the stress, and it's not going to provide the same protection when the knee is twisted. And so, we're able to help these without surgery, okay? And so the type of ACL tears you might obtain are called a partial tear, which just a portion of the ligament is injured. A full thickness tear that's non-retracted may be most of the ligament is torn. It might be exploded like a frayed rope, or it might be kind of cutting apart, but there's at least some fibers held together. There's a sheath around the ACL that holds it together. So if those fibers are at least close to each other, talking to each other, we can help those. The ones that we can't help is when it's a full thickness tear, meaning it's cut all the way through and the band is snapped back. So if the ACL is torn off the bone or there's a tear in the middle and it's completely snapped back, then no type of injection is going to help that. Those are the ones that will have to have surgery if you want to fix them to the best they can. Alrighty, so like we talked about before, these are very precise, highly advanced injections using X-ray or fluoroscopy to target both bundles, where it inserts and where it comes from on the femur to get success. If you don't do this, it's not going to help. We've seen some places where they just inject in the knee randomly or try to do an ultrasound to try to get ACLs to heal, and this will not be successful or help. Okay, so this is just an example of what it looks like. You can see the two bundles of the ACL. This is one bundle, this is another bundle, looking straight on. We inject contrast to make sure we know we're getting a great flow across the ACL to treat that. And this is just a side view of, we can even treat partially torn ACL grafts. So if you did have ACL surgery and you had a partial tear of the graft, then we can treat those as well. And this is another important topic with surgery, is that when you have surgery, they're usually going to replace the ACL not with another ligament, but with the tendon, either your patella tendon, hamstring tendon, or IT band. And that's going to cause some injury at the site where they use the graft. So you might have patella pain or hamstring weakness or IT band pain or weakness from that. And then also that tendon isn't, again, as strong as the normal ligament. Sometimes they would do cadaver grafts, which are not as strong as your normal equipment, even though you at least don't have that graft site, harbor spot pain afterwards. So, you know, there's meat behind what we do. So we've published two big studies or two small studies on treating ACLs that have been peer reviewed. And we also have completed a whole randomized controlled trial, which is the kind of one of the best types of trials you can do, where we randomize patients to randomly have the ACL stem cell treatment versus having just physical therapy, conservative care, and showing those results. We'll go over that. We haven't submitted this for publication yet. We've finished enrolling, but we still have some patients that are maybe a year out and we're following them up to 2 years. So we'll probably publish some of the early data and then publish the full study. It's going to take maybe another year or two. So this is just an example of some objective changes. So when you look on an MRI, a normal ACL will look dark where the fiber should be. An ACL that's torn will look light or white on specific images. And so we use a specific program with our study to look and see how an ACL improved after treatment. So this is an example of a tear where the ACL is gray, it's thick, it's like a frayed rope. This white line is the tear. This just represents the lightness of this area. And then when we treat it, we can see that the tendon is more taut, it's darker, you don't see that tear, it's healing up, and that's objective findings of it being darker on a specific program we used. This is just another example of that. This ACL is okay distally or at the insertion, but this part of the ACL is torn, it's white, it's bright. The pixels over here show it's much whiter. And then when we treat it afterwards, we can see that area fill in quite nicely with dark normal tissue, and that looks better objectively on the computer program. And so I asked our statistician to pull up some of the data from the randomized controlled trial. As you can just see the difference between the treatment group and the exercise group. The SANE score is basically just asking the patient, what percentage improved do you think your knee is? And so after 3 months of doing physical therapy, there was minimum benefit. Whereas after doing the stem cell procedure at 3 months, there was more than 60% improvement. And then it continued to get better and better over the course of 2 years. Things continue to improve, 80 to 90% improvement that the patient themselves reported. And then over here, this IKDC is basically just a functional score. How functional is the knee? How much activity can you get back to doing? And that exercise group here, maybe a little bit improvements at first that plateaued and they even got worse because they probably tried to do more and the knee was unstable, versus in the treatment group, we can see function continue to improve and get better and better and better. And these stars represent that improvement is much different than the exercise group statistically and meets all those requirements. And these are just more pictures. We have more than 50 pictures of just showing ACL tears that look better on MRI. So this is just an example of a wavy, loose, thick white ACL that's again like a frayed rope. We treat it, more aligned fibers, it's thinner, it's taut, more normal appearing. Just some more pictures of, here's that ACL tear at the pre-procedure MRI. If we look at it, this is about 3 to 6 months after, it looks better. And then we look at it 6 to 12 months better, it looks pretty much near normal. So you continue to get this improved over time. And so it's also important to maybe just talk about recovery. When you have surgery, you know, it's going to be a long recovery. Return to sports is anywhere between nine months to 2 years. Typically after this, the recovery is much quicker because we're not doing any cutting or surgeries. Return to sports can vary depending on how bad the tear was, between 3 months and a year or so. So we can see here, this ACL, all white in here, you don't see any organized tissue, doesn't look like a dark line like this PCL, which is the sister or brother ligament to the ACL. After 3 months, it's starting to form some better fibers. After 6 months, even better. And after 11 months, looks pretty close to normal. So can stem cells help ACL tears? Yes, in the appropriate patients. So we have to make sure that it's a partial tear or complete but not retracted tear. If it's completely retracted, then there's no point in us trying this. It won't help for that. You need to look at the surgical options. And also, you know, just not doing any type of treatment will help. You have to make sure you're using bone marrow concentrate with stem cells for most of these tears. PRP can sometimes work, and it's a very, very mild tear, but you have to be using the right product. So amniotic fluid and amniotic stem cells that don't have any live functional stem cells are not going to help. So what's injected matters. How it's injected matters. So to get this to work, we have to place it directly into the ACL at multiple areas to make sure we can get those things to heal. Requires a precise procedure with X-ray, not just a simple injection. We have to make sure the stem cells are alive. So that is usually the stem cells coming from your bone marrow that are autologous, meaning they come from you and go back to you. And, you know, again, there are no stem cells in these umbilical cord, amniotic, birth tissue products. 3 labs have tested this and found 0 living stem cells, so that's not going to work. And then, you know, obviously every patient is going to have to, you know, address some of the weakness and biomechanical problems that occurred maybe before the injury and afterwards. So physical therapy is essential. We give everybody a rehab protocol. Most people will get braces to use for temporary periods to help just add some extra protection. You know, again, we've seen amazing results, better recoveries. You know, right now it's too early to say if it prevents arthritis, but at least keeps your ACL intact. So you have your own fibers, it keeps it at the same angle. So it's more likely to prevent arthritis, but we have to wait with time to see if that pans out. Also with surgery, you know, there you're just fixing your ACL. Oftentimes when you tear your ACL, you injure your meniscus and your MCL. And either that's not helped with the surgery, or they'll do a meniscectomy, which is just removing part of the torn meniscus, which now multiple large level 1 best evidence studies show that not only doesn't work, but progresses arthritis faster and is actually harmful. So we can treat those meniscus and MCL tears and other ligaments that might be injured that surgery wouldn't address as well to get the patient fully better. So that's me. That's the presentation. Love to hear any specific questions that anyone has at this point. Now,